Break a leg.
Hello, everyone, and welcome to Navigating the Costs of Care. This is brought to you by Patients Rising University. Today, we're going to be giving you a financial primer in how to budget and manage the cost of your treatment. Your panelists today are Clara Lambert, an oncology financial navigator at the Advocate Good Samaritan Hospital Cancer Center in Downers Grove, Illinois. And prior to this, she helped pioneer and found the financial navigation program at the Cowell Family Cancer Center in Traverse, Michigan. I know from experience from having interviewed Clara before that this all came about. Her career in financial oncology financial navigation came directly through her being a caregiver and having to navigate the system for her husband. So I'm sure you'll hear a lot about that today, but welcome, Clara.
Thank you.
And we also have with us a patient, a health and wellness coach, and patient expert, Samantha Smith. Samantha is a health and wellness coach and vice president for GPACT, a nonprofit patient support group for gastroparesis. She was born, raised, and still lives in upstate New York, where in the warmer weather she loves to run. Sam has organized fundraisers, lobbied Congress, and been part of many awareness campaigns for chronic disease awareness. Welcome, Sam.
Hi, thank you for having me.
And finally, this is me. I'm Terry Wilcox. I'm the executive director of Patients Rising and Patients Rising Now, and I welcome you to our webinar today. Today, we're going to go through 4 modules. We did this with our webinar last month. We have 4 separate sections to sort of guide you through this process, or what we believe is a good process for figuring out the real cost of living, how you can afford your disease, finding the financial help you need, and empowering your caregiver. And when we go through affording your disease, well, I'll start at the beginning. The real cost of living, this is where we're going to show you the hidden cost you need to know about to make a budget. And in affording your disease, we'll show you how to learn what cost your specific disease demands. And then finding financial help. And here we have an extensive list of resources available to help you afford your care costs. And then finally, financially empowering your caregiver. Caregivers do so much, and there's many ways that we can help them be successful on your behalf. Patients Rising University. This is our online education website, where we give you a lot of information about navigating your care and your treatment. Last month, we launched our first course for the year, which was Getting Organized. This month, we're doing financial navigation. Next month, we'll be doing a course on clinical trials. As we go along, we'll be reviewing after each module. We'll have worksheets you can download, and like I said, the webinar is being recorded. Here's our first section, the real cost of living, so which I'm sure all of you can relate to, both Clara and Sam, given what you've both been through. And I can even relate to this in many instances with my own health struggle, challenges, and issues. So without further ado, we will get into what our objective is here and what we're going to be looking at, which is, I know it may seem rudimentary to some of you, but understanding the basics of making a budget is so important. And that's not just important, as many of you know, in navigating the cost of having a chronic illness, but it's also important in getting, with anything we're doing in life. And a lot of us don't really know how to do that. I find it so fascinating that it's not one of the things that they teach you in like adulting when you're in high school anymore. It's not really a focus, and goodness, it should be. And then we'll also get a realistic look at the costs of living with your chronic illness and the things that, your day-to-day expenses, and how to sort of figure all of that out. Clara, I'm going to let you take it over from here. I know this is your expertise, and you talk to many of your patients about that. So without further ado, Clara Lambert.
Yeah, so I think it's good that we all get on the same page and just look over make sure that we all have the same definitions for the vocabulary that we're going to be using throughout this webinar. So fixed expenses are stable, they're the same every month, like your rent or your house payment. Flexible expenses, those change. Like I think the electric bill is probably the best example. Like my electric bill this year, because I have electric heat, was pretty high over the winter because it got cold. And then it goes down as the temperature gets more comfortable outside. And then there's periodic expenses, and those are things that happen not on a regular basis, but definitely something you have to pay attention to. And I usually try to divide them out so that I have it in my budget monthly. And then total expenses are all of these added together. All right, budgeting is providing a set amount of money towards expenses, and I alluded to that in the last definition, and we'll get deeper into that. And then there's a new definition that probably isn't as common to all of you as the previous definitions, but financial toxicity, and that has to do with how your finances can affect your quality of life and your access to medical care. So like an example of financial toxicity is a patient purchasing a prescription and maybe taking a pill every other day instead of every day. So they're not getting the treatment that the doctor intended for them. Or maybe deciding not to have a treatment because they can't afford it. So that would be financial toxicity. And then I'm going to pass it to Samantha for some deeper looks.
Now, the monthly fixed costs, a lot of what you see on the screen, some of them do vary from person to person, but what I do for myself, having to budget to be able to afford doctor visits and my medications and things like that, these fixed costs don't change every month. So for me, each month I write down in my calendar, I'm a pen and paper kind of person, but not everybody is like that, and write down the dates that they're due. If you do prefer to use your phone or something like that, a great thing to do is to put reminders on your phone to tell you that these costs are coming up so you don't forget them, because our lives do get a little bit crazy, and sometimes even though they are fixed costs and we're used to paying them every month, sometimes things can slip a little bit. But to have a due date and to keep track of them, just writing them down each month, knowing how much they cost and when they're due, and whether or not it's an automatic payment that comes out, or you're going to send a check, when you have to send the money is going to vary payment to payment. The monthly flexible costs, these are the usual costs that you have every month, but they're not necessarily the same. Some that we have mentioned here, just like Clara mentioned about the electricity bill, you know that you'll always have that bill, but the amount might change, like your cell phone and your credit card and those utilities. Again, I think that it's easier to budget when you know what your fixed costs are. So once you have established every month what your fixed costs are and how much you're putting out for those, you have a better understanding of what the last bit of your or other costs that are a little bit more flexible are. It's good, even if you're estimating the cost, it might be better to estimate up instead of down. That way you're thinking that you might be spending more, and you kind of allot for some of the bills being a little bit higher. And if they aren't higher, then you're able to pay them, or at least understand that you have a little extra to go for something else. Now, the periodic fixed costs, at least for me, can be a pain in the butt sometimes, and they can sneak up on you. They're the things that might happen quarterly or bi-monthly or just once a year, every 6 months, all of those types of things. And again, I think that having reminders set, whether it's on your phone or in a planner or anything like that, to say, hey, this is coming up in 3 months. And if you just put a couple dollars away toward your car registration, $1 might not seem like much, but if you keep putting in a couple dollars, you've got a couple dollars more than where you started with. These are the great things that you know, having some sort of budget, or at least understanding that these costs might pop up, so you don't forget about them and can hopefully try to budget them into your life, can make things a little bit easier for you. Now, these are the other giant pains in the butt, the flexible costs that you can't predict, or the periodic things that come in, like a broken utility, or your car breaks down and you have to fix it, and it's something that maybe you didn't allot for that month, or something that's not normally in your budget. Something like a rainy day fund, these are the types of things that are very hard to predict, but those are the funds that you might need later down the road. So again, I think just if it's possible for you to maybe just put $1 or $2 a little bit away every month or every week, whatever you can possibly do, it gives you a little bit of something to start with when these flexible costs tend to pop up. Something like back to school supplies, you know that generally you go back to school around the same time every year. So you can put a reminder in June at the end of the school year to say, hey, I need to start making sure that I have enough money to buy X, Y, and Z for the start of the next school year.
Yeah, and Sam, one of the things on the periodic flexible cost, as somebody who has actually listened to and sort of done a lot of the steps of the Dave Ramsey budgeting stuff myself, one of the first things that he says is to save $1,000 for exactly what you're talking about here. Like, that seems like a lot of steps, but just to have that small amount put aside for this kind of flexible stuff, like, oh my gosh, I have a broken utility. Oh my gosh, I got to get new tires. Like, having a place for that, because that is one of the things that can throw us out of whack the fastest.
Definitely.
Surprise sort of expenses.
I know for myself, I do have a savings like that I actually don't touch. And I know that it's there if I need it, but if I don't need it, it just sits and kind of accrues interest. And for me, if I do need a little bit extra, I might touch the interest that it built instead. You know, if it's not something huge, but just something a little bit extra that I might not be able to have the money right then and there for, you know, I know that that money is there, but I don't spend it, kind of forget about it unless something crazy comes up, like a car repair, broken utility, you know, anything that you just were not expecting and now you didn't have the money for it, but that's what that fund is for. It's not easy to build. It definitely took a while to get myself there, but once I got myself there, I set it and I forgot it. So that way I don't really touch it.
Once I got that particular, once I got there as well, I had it set aside over there. And then it was like, now I don't touch it for anything. It's actually at a different bank. Like, it's at a different
That's what I did.
It's not even like, you know, it's something that I really have to think about and go like, okay, I'm really in a bind and I need to get into this money for this reason. It's not because, you know, it's never frivolous, but you really have to think about it. It's something that, and it does take a huge weight off for those kinds of expenses. So,
yeah, what I did is I hid the balance on, so when I pull up my bank account balances, that one, it just says balance not shown, because then it's not added into, you know, like what my available money is.
Oh, that's
a really good idea.
That's a good idea as well. Anyway, I moved
that
on.
Way it's not tempting.
Exactly. I moved on here while we were all chatting to the day-to-day costs, which these are the ones that can sneak up on you and get you in trouble. And one of the things I'll just say for my part that I use for this kind of stuff is, let's take coffee. Okay. I allow myself a certain amount on a Starbucks gift card that's in my Starbucks app a month. And once that's gone, I don't get to go to Starbucks anymore that month. You know what I mean?
Yeah.
So like, you can actually budget these things in those kinds of ways. You know, and I try to budget enough so I'm not deprived, but I don't make it ridiculous. You know, you try to meet somewhere so that you're not constantly feeling like you know, can't have anything. But these are important. Yeah. And I do, like, my charity donations are automatic deductions. I give small amounts to a few different charities each month. And I budget that way. But yeah, this is The day-to-day costs are where you can get into trouble and just sort of like overspend because you don't really have a technical budget, but it's good to try to set one based on your habits. And you can do a lot of that just by looking at your, how you charge things, or saving your receipts, or writing what you spend down, or, do a diary of like what you're spending every day for a week or so. And you'll see. You'll be able to predict it. It's why our credit cards can predict where we're spending stuff, because we all have habits. So anyway,
I know. I think for me, I like to pick one thing to splurge on each week. I am a big coffee drinker, and for me, making coffee at home was the best thing I could do for my wallet. But, I don't want to deprive myself either, but I might not be able to go out to eat 6-7 days a week, but I could do it one day a week.
Mm-hmm.
That way I still am able to do something, but it doesn't have to be every single day.
I agree.
And I try to put some fun in my budget. So like that, like going out to eat or something like that. And I plan, a certain amount per person. It's just my husband and I, but there's a certain amount per person of fun each week, and we can save it up and do something big each month. We can do something little each week. And then what I do at the end of the month is, if we haven't spent it all, then the remaining money goes into a savings account for a vacation. So like that money is just all about fun.
That's a good idea.
Yeah, that's great. I mean, one of the big things that I have learned about budgeting over time is that you have to tell every dollar where to go. Like you have to give every dollar a job. Otherwise, that's a way you can really get into trouble, because you can just start spending and not have enough dollars. So that's one of my things. I have moved on here while we were talking. I sort of snuck in and moved on to the strategies. For you, Claire, if you want to kind of talk to us about some of the strategies that you used for the different types of expenses.
Yeah, so what I've done with, I'm all about, I have a calendar, I write it down. I feel like that manual visual is really what it takes. That's when I excel at my budgeting, is when I'm doing it that way. But I definitely use my online banking. I make as many payments through that as I can. And as their software is updated, now I can see, they'll show me my pending payments and my pending balance. So that helps too. As far as those periodic costs, I try to, like my garbage, we pay it every 3 months. It's not a huge amount, but it's a big chunk to the budget. If I do it every 3 months, then it kind of throws my budget out of whack. So I consider a third of it each month when I'm budgeting. The other thing, as far as those flexible costs, I try with my utility companies to get on the budget plan. And they usually, some of them will do it right away for you. A lot of times they'll want you to be in the same house for a year so that they can figure it out. And then they adjust based on your usage, every 3 to 6 months. But that's really helped me a lot. I usually try to get on the budget plans. And then as far as, there's some different things sometimes you can do as far as your insurance, like car insurance. Always keep looking around, see if they have a monthly payment plan that doesn't have any additional costs associated, and make sure you're comparing that regularly, because I've found sometimes if I get a little too comfortable with one company and then I check, I'm like, oh my goodness, I could have been saving so much money. And then there's the healthcare costs. So
yes.
That's what we're here about today. 1 in 6 Americans have past due healthcare bills on their credit report, and that debt totals $81 billion.
Wow.
More than half those bills are actually, so more than half, so 53% of those are actually the bill, each bill is less than $600. So there's a ton of small balance bills on people's credit reports that are medical debt.
I know, and it's one of the things I found this interesting when I looked at this particular slide, which is 53% of debt is less than $600. It's one of my biggest pet peeves when I go to the doctor, because I'll tell you, my husband and I were a victim of one of those. I think the bill was $83.12, or I don't even know what it was, but it didn't get paid, and we moved, and I don't know what happened, but it ended up being this. We went to buy our house, and it was like this big holdup of this big ding on our credit was this stupid $83 bill that neither one of us could really find, and we couldn't figure out who we owed it to. And I mean, eventually we got it worked out, but it is amazing, like, how much you need to keep on top of and organize all of these little tiny bills that you end up having to pay oftentimes, even when whether you have insurance or don't, that you just sort of, they come in the mail, and we're not as mail driven a society as we once were. We're very electronic. Yeah. So anyway,
and then, like,
one of the things that I wasn't surprised by that number, it was such a small amount for more than half of the credit report dings.
Right. And then they don't really, like doctors' offices and hospitals, they don't consolidate your bills into like one. Every time you walk in the door is a separate bill. So, right. That's one of those things. Yeah. But a lot of times you can get them to put them together for a payment plan, just for future.
Got it. Yep. Okay.
So now with care costs, some are flexible and some are fixed, like we've been talking about. Like, if you have regular prescriptions that you're taking just for maintenance, usually the prices don't change too much. So you have a good idea of, for your maintenance prescriptions, what you're going to be paying each month. Copays are a set dollar amount, so when you go to the doctor, it's going to cost you $20. When you go to the specialist, it's going to cost you $50 or something like that.
Right. It's all of these care costs. This is oftentimes when we're doing things like focusing on explaining. When we do comments, oftentimes as an organization, we'll do comments. And one of the things that we often talk about when we do those comments to various organizations, whether it's Health and Human Services or whether it's the ICER, which is an organization that tries to put a value on what medicines should cost and things like that. Oh, this is the one section. This is the place where nobody really wants to take into consideration the actual true costs of what patients are enduring to either pick up the prescription, get the prescription, go to the doctor, and all of those things. And I know we're going to be talking or doing a little breakdown of that on the next slide. Missing work, the transportation costs, none of this is really included. And that's why a course like this is so important for you to try to figure out or budget or estimate these things, because these are the things that nobody, your insurance company, your employer, nobody's really taking these things into consideration. And the only way to get a hold of them is to try to do it with yourself and your care team as best you can, or your family and whoever might be supporting you as a caregiver. And what I was just talking about, this is a theoretical example. Okay, we know our copay is going to be $30, right? We know our office visit copay, but to get there, I've got to get in a car, and I've got to go, and my toll is this, and I'm going to drive. So my gas amount is this. I'm going to park. It's this. I've got to have somebody watch my kids while I'm gone. It costs this, and there's all variations of this. Maybe you don't have a toll or gas or parking, but you have, a metro or a subway ride. And then you have another couple of miles in an Uber or something, but you have to figure out the actual cost. So what's a $30 copay is actually almost a $60 visit for you in cost. And one thing we haven't even figured in here is, do you lose any time from work? Do you lose any funds that way? So there's so many things to consider in sitting down to look at these. So now quickly with the I'll do a quick overview. We've kind of done a lot of this, but this is everything that we talked about in our first section. Financial toxicity. which is, in order to avoid that, you must create a budget and get your expenses on pen and paper, or, you know, do a digital list, or however works best for you. But this is so, so important. Expenses, they fall into 3 categories. Those that are fixed, those that you can depend on every month, they're the same. Those that are flexible, and those that are periodic. And whenever possible, you want to break down your periodic expenses. So, for example, I do have a quarterly trash payment. I think it's $120. So I break that out I break that into a monthly amount. And I put that in my budget every month so that I know what that is. More than half of all debt in America is medical debt. I'm not surprised. And the only way to successfully budget for care costs is to take a long, hard look at what the real costs are. And sometimes, and this can be, as somebody who's done it, it can be painful, but it's something that's extremely necessary in order for you to succeed through this and make sure that you have everything you need to manage your disease. Now, the next thing we're going to get to is affording your disease. In this section, I'm going to let Sam take it off here, but there's many variables within this that we haven't even hit on in the cost of living. But now we're going to talk about the cost of being sick and what that requires. So Sam, I'll let you take it from here.
Okay. I know we mentioned, or Terry mentioned earlier, that I work with GPAC. It's a nonprofit for gastroparesis. I myself have gastroparesis, and I am also tube fed. So for me, under special foods, I require tube feeds. And, you know, not only do I have to think about carrying that and making sure that I have what I need, there is a cost for things. You know, insurance only can cost or really pay for so much. Sometimes you might be lucky enough that they cover everything, but more often than not, there is a cost here for the patient. Durable medical equipment, I'm a diabetic also, so some of my equipment that I need, that's pumps and different types of pumps for my diabetes or for the feeding tube, they fall under durable medical equipment. And again, there's copay costs for some of these. You've got parenteral nutrition with your feeding tube supplies. I also require IV medication, and all of that together, when you get a bill from your home health company or maybe your specialty pharmacy or things like that, sometimes those numbers that you get can be very, very scary. And thankfully for myself, I do get good coverage with those most of the time, but you do end up getting these bills here and there to have to pay to get the required equipment that you need. And sometimes different remote care. I know for a time I was traveling to my local hospital 3 days a week for treatment. So to do that, either I myself or my mom or my dad were taking off of work to get me to the hospital and waiting there for the treatment and then bringing me back home. There was a lot of time that was off of work. And I know mentioned in a couple slides prior, when it's budgeted into your doctor visit, either you're possibly losing vacation time or maybe just time because you only work part-time and you don't have vacation. It all is diagnosis dependent on what you might need, but these are the types of things you want to talk to your doctor about. What does my diagnosis require? And with these questions, how often do I need to be seen? I myself see all my providers about every 3 months or so, but that can change depending on how the severity of your disease, what treatments you might need, where do you go? For an emergency, I try to make sure that I go to the hospitals that my doctors are associated with, so my records are more easily accessible to the doctors that don't know me very well. To look up if your doctor or your labs are in network, most insurance companies, you can go on their websites and they have, I know for my insurance company, it's called Find a Doctor, and you can type in the doctor's name or the hospital they work at and easily find out if they're in network and out of network. There are costs associated with going to an out of network doctor, but you can talk to your insurance company about those types of costs. A lot of these questions do have costs associated with them, but you can talk to your doctors and your insurance companies, and even sometimes the doctor's offices and the associated hospitals about payment plans for your regular treatments or your regular appointments and whatnot. I know I had to do that, and it definitely helped when I was able to sit down and say, this is what I need from my doctors, and I can't afford this, so how can I do that? And I got put on the payment plan to be able to afford the treatments that I needed at the time.
And this question, I've had firsthand experience with this question, where do I go in an emergency, is actually a really important question, because oftentimes, well, there's two different things to know here. I know from a family experience, like my father, who is a type 1 diabetic, he had a 911 emergency because he went into shock. My stepmother called 911. And she had remembered that my dad had told her the last time he went to the emergency room that he didn't like the food and the place that they took him closest to the house. Well, so she told the the ambulance to take him to another place, and didn't think anything of it because she just thought emergency rooms were all created equal. Well, that cost them $1,500. That decision to try to get a better meal was a $1,500 mistake. So it's always important to know, like, where you need to go to be in network. And even when you get to the hospital, making sure that everybody who's seeing you is in your network, because that's what's called surprise billing. But anyway, all of these things are so important. Is the lab in your network, which is going to take us to our next slide with Clara.
Yeah, so this is just a really good example about in-network and out-of-network, and whether you're going to the lab or going to the hospital. But anyways, I think right here is just another thing to reiterate how important it is to make sure you know your providers and their network status. And then also if they use, like, most of the time, well, sometimes depending on where you're at, when I lived in Michigan, I was in a more rural area, so we didn't have an outside laboratory. We had just the hospital laboratory, but then sometimes they would send out to another lab, and then you're out of control sometimes as to if it's in network or out of network, but it was depending on the test. So it is important to check. You can find all this information online with your insurance, and just to know that you can go to the provider you want, and you can ask them to use your in-network providers. And if you are in a more rural area and there isn't a specialist or there isn't a lab that is in network for you, you can ask your insurance to do a single case agreement, since there isn't anything nearby for you. And they typically will do something like that if there isn't an in-network within a certain distance.
Oh, that's really good to know. Now I'm going to talk to you a little bit about, these are a lot of the topics that we talk quite a bit about at Patients Rising and our policy arm, Patients Rising Now, and some of the things that you need to look out for with your insurance specifically, especially if you're on specialty medications, and that's starting off the top of the page there, specialty drugs on formulary, and if they are on formulary, what tier? A small percentage of medications in this country are specialty medications, but for those who are on them, they know it, because they have, you can those come with all sorts of co-insurance and high deductibles that you have to meet and things like that. So one of the first things you need to do is make sure that whatever you're taking is on your formulary, and you need to do this every year. You can't just rest on the fact that it was covered one year and it'll be covered the next year, because that's just not how insurance works anymore. Second thing you need to know is, can you limit the length of treatment or number of visits? This is, one of the things that you can ask your doctor. Is there a way to get everything in one visit, or do I, this sometimes happens for cancer patients. They'll get their chemo, and then there may be some sort of supportive care medication that they may or may not have to come back for, something that they can take home. Now, oftentimes they can do it right there on the same day that you're getting your chemo. But you just need to make sure that all of those things, if you feel like you're looking at a lot of visits, you want to try to see if there's any way to condense those just for your own time and your own well-being. Another thing you need to look out for is step therapy, which is, and this can happen from insurance plan to insurance plan. Step therapy is when they make you go through a tier of medications in order to be able to take oftentimes what your doctor wants to go ahead and give you because they think you're already in need of that medication. Now, what happens a lot of times to chronic disease patients is that they'll switch insurance because on average, we have the same insurance for, I think it's 3 years now or something like that, or the same carrier, because employers and everyone switch things up. They get better deals, or they want to try to cut costs. So it's constantly shifting under our feet. And so you may be on, let's say, Cigna 1 year, and you went through this one medication, didn't work for you. You went through this other medication, it didn't work for you. You and your doctor found one that is perfect. You got it approved by insurance because you'd tried some things that they suggested first, didn't work. And then you switch insurance. And then you may have to do that all over again if you don't really fight for it, which is really horrible because you already know these things don't work. Now, they're trying to put things in place, and there's a lot of laws and things that are being passed in various states that are trying to help with this, because you shouldn't have to go through again what you've already gone through. When something's already been proven to not work for you, you shouldn't have to try it again just because you changed insurance. What other requirements are the requirements that you have? Like, you have to go to specific locations for treatment. Oftentimes this has happened a lot with the mergers of, independent doctors' offices and hospitals. Everything's being condensed into hospital systems. And oftentimes for rural patients, this can be a real challenge because, there may not be the doctors and the treatments and the things that they need close to home, where there may have been once previously. I know when I got started as a patient advocate, which is about a decade ago now, 85% of oncology care took place in the community setting. And this includes, the rural setting and also community practices within cities as well. But it took place in these smaller clinics. And now that's dwindled down to 70% because of these, or I think it may even be less than 70% now, but it's dwindled down because of these mergers. So that's something else to look out for. If you find out if you have someone close to home, can you go to them and find, and also moving on to the next couple of things here. I feel like I might be a little long-winded, but I'm just trying to get it all explained to you. Make sure that you have, if you need durable medical equipment, make sure that you have that coverage. Find out if the equipment that you need is covered, and what sort of things you need from your doctor or prescribing folks to find out what your insurance needs to make sure that's covered, because that can get really, really expensive. And last but not least, this is something new that started last year. It's called copay accumulators. And we're just now starting. We have many, many patients who are very angry about this particular one. Copay accumulators, a lot of patients, especially those on specialty medications, receive patient assistance from drug manufacturers that often will cover their high deductible or out-of-pocket costs to get them over the threshold so that they can afford their medication. And that used to work great. And now the insurance companies and the employers have decided, you know what, if they're getting assistance from a drug manufacturer, we'll count that for a certain, until it runs out. But we're not going to count it towards your deductible, towards your payment. So what'll happen is you'll go along, you'll be using your copay assistance, and then about, this time of year, April, May, and June seems to be when it hits several folks. all of a sudden you'll go to the pharmacy counter and that'll be, you know, $2,647, please. And you're like, what? That's what a copay accumulator is, because they've used up all of your assistance and they've taken it and put it in their pocket and put it on their side. But they're saying, oh, no, you need to have skin in the game, so you need to pay this now, and you need to meet your deductible. So that is sort of shady. It's a little more than shady. And they're not all sending out letters and letting you know that this is happening. And we've talked to many patients about this particular occurrence. And if any of you have experienced this, please, you know, we have written a ton about this. It is a terrible practice. And a lot of people will say, those on the other side of the coin on this will say, well, a lot of these copay assistance plans, they drive up the cost of medications, and, you know, these copay cards are not good and we need to get rid of them. And we at Patients Rising say, okay, well, that's great. That's fine. Let's get rid of them. But you can't just pull the wool, you know, you can't just do this until there's something to replace this with. Right now, insurers are forcing you into high deductible plans, or more employers are. So many patients have higher premiums and higher coinsurance than they've ever had before, and higher deductibles than they've ever had before. And so all of a sudden, you know, this is one of the things that the manufacturers have come up with to help patients navigate that and be able to afford their treatment. And it's fine if we want to come up with another option, but this isn't it. This copay accumulator thing, from where we sit, is not it. It's harming patients, and it's taking a benefit that's been given to them away. And it's, as far as we're concerned, it's very shady. I should have gone on. Here, this is good, because I can explain these things to you. I'm sorry, I kind of babbled through all of this and didn't move through the slide. But what an accumulator is the total cost paid by patients towards your deductible. So that's what it accumulates. The pharmacy benefit manager is the person who's managing your benefit. Your copay assistance is what's been given to you by your medication, the manufacturer of your medication, and the copay accumulator is what I just talked about. So anyway, now I will move on to Clara, which is common mistakes in your medical bills, and she knows a lot about this, having talked to her before in depth. So Clara?
Yeah, so one more thing about the copay accumulator. I had one patient that we outsmarted it just a little bit. He actually had a credit card that had the allowable limit on it, so he paid for it with a credit card and then got reimbursed from the copay assistance program. And so we kind of went around it, but I know that not everybody has that credit card availability. So common mistakes in your medical bills: double billing. I don't see it happen very often, but you can ask for an itemized bill, and on an itemized bill you can see absolutely every single charge that was billed to you. And just remember that it would be being charged multiple times, more than once for the same thing at the same time from the same provider. But I think a big thing is don't confuse that with getting a bill. Like if you go get a CAT scan at the hospital, you're going to get two bills. You're going to get one from the hospital for the actual scan, and you're going to get one from the radiologist for reading the scan. So don't get that confused. Make sure that that you're being billed for what actually happened and not things that might not have happened. And then I think the big thing is the coding errors. There are some treatments or tests that actually depend on specific codes to get payment or to show medical necessity in order to be paid. And then there's also some codes for treatments that require authorizations. So it's very important that the coding that's being done to tell the insurance company what's going on is done correctly, and that when you're getting an authorization, you use the code that's going to be used when it gets billed.
Gotcha.
And so I'll pass on to Samantha about if you can't work anymore.
Now this one is a little hard for me being a patient to talk about, only because you get to a point where you don't want to work yourself into the ground and make yourself, you know, possibly feel worse because you're doing too much. But sometimes it's hard to decide whether or not you want to apply for these types of programs. But I know for myself that that's what these programs are for. They're here to help people like us in these types of situations who need to make sure that we're able to afford the coverage and the quality care that we need in order to thrive in our life. I've had some help applying for Medicaid a few years ago. The hospital I worked at, or that I was going to for treatment, helped me sign up for that because I was unable to afford the treatments that I was getting. And thinking about Social Security, disability income, and supplemental security income, they can be very confusing, and it can be hard to know what you qualify for. The website that we have shown here is a great place to start. There's tons of information listed on the website, and as you start to go through it to think, do I qualify for this or do I not? You can make appointments with the local offices to ask these questions and then see what you need to apply for these types of programs. Now for SSDI, you know, that's based on work credits. So if you are like me and are only in your 20s, you haven't had a long year, you know, many years of work where you have a lot of work credits. So this type of program may not be for you. But SSI, the Social Security income, might be a better place for you to start. And again, the people at the offices, you can ask these questions and talk to them about it. And sometimes you might need this type of income just for a little while, just until you get on your feet. And then maybe you don't need it anymore. Or maybe this is something where you've gotten to a point where you can no longer work. And this type of program will help you figure out your insurances. It'll help you figure out your money. It can help you pay for your food, your clothing, the roof over your head to make sure that you are being taken care of the best way possible. It is hard to navigate. It's a very confusing system. I'm still learning it as I've been navigating it over the last probably 5 years of my life. But the best thing I can say is to make sure you ask questions, and when you get things in the mail, read them and don't forget about them, because a lot of the things can be very time sensitive.
Great. Clara, did you want to add anything about SSI?
No, Sam covered it really well.
Okay.
So
Okay.
yeah, we're good.
Okay, great. All right. So when you're living on SSI, Clara, do you have any advice for folks on what's covered there and what we should know based on?
Well, I think when you're living on supplemental security income, it's a very limited amount. So that earlier when we were talking about budgets, that's so important to review, like if your income changes or goes down, to review your budget. But most of the time, if you are on SSI, you're likely on Medicaid, and it will help cover your prescriptions, your doctor visits, and all of the healthcare expenses. So it should help your budget in that way.
Okay.
There are some financial issues to consider with Medicaid, and I'll let Sam talk about that.
Okay. One thing with Medicaid that I want to mention that I actually didn't know, not prior to this, but I didn't know until it happened to me, about Medicaid ending and authorizations and things like that. I didn't know when I applied that you have to reapply every year, that you need to send in your information at whatever time you signed up the year prior. Say it was August, the following August, they're going to send you information and say, please fill out these forms. Well, I didn't know you had to do that, and I ended up losing my Medicaid because of it. So one of the things to maybe add into your budget, even though it's not looking at it as money, it does affect your money, to make sure that you're on the lookout at a certain time of year for these types of forms, to make sure that you don't lose any sort of supplemental income or anything that helps you that you may have already budgeted into the future. All that type of reapplying, I definitely learned that the hard way. My paperwork got lost in the mail, but if I had realized that I needed to do that, I would have noticed that, hey, I didn't get these forms. I need to find out what's going on. So
right.
I called my county's DSS office and talked to someone down there. And again, the best thing that being a patient in navigating these very difficult programs, and sometimes when it's hard to get somebody on the phone, but when you do, is just to ask questions, that you shouldn't be afraid to ask them. I know sometimes talking about these sorts of things can be a little bit uncomfortable and maybe you don't know what to ask, but that's what these people are there for. They're there to help you navigate the system. I actually just found out too that Medicaid offers, I don't know quite the term for it, but I'll just say advisor, somebody to help you, to sit down with you that knows your case, that knows what you're going through and knows the programs that can help you, what other benefits you might be entitled to that you're not getting because you didn't even know that they existed. So I think that just paying attention to what the program is and then asking questions when you don't understand is probably one of the best things you can do for yourself.
Right. And then we're moving on here to, within that, there's a disease-specific life hacks. Now, what is your recommendation on this as somebody who's probably had to use a few of these?
Well, what's funny actually is when I was first diagnosed with gastroparesis, I went to found GPAC's website to help me figure out questions to ask my doctor, what to do. I got into their Facebook groups and then found their groups with Inspire, and that kind of snowballed off into NORD, where they have tons of information there. And now, all these years later, I actually am the VP of GPAC and work very closely and have a great relationship with that whole community. And I actually have been a rare disease runner for NORD. So it's really great. I think social media can have its downfalls, but it's really great to jump into these groups. You don't have to talk. You can be a fly on the wall, but just to look out for these groups, because it can be very isolating to be sick. And when you've gotten into these groups, you can find other people that are just like you and that say, hey, I've been through that too. You might find somebody that lives 20 miles away from you and they become a really good close friend of yours. So I think that checking out Facebook and Inspire and NORD, all of these places, or you can Google your diagnosis, your support organization might pop up. I know for some of mine, that's how I found and got associated with these different groups. And honestly, that was probably some of the best things I ever did for myself, because all of those steps actually led me here to be able to help other people in the position that I was in 5 years ago to say, hey, this is what works for me, or this is some new information, and this is where we share it. And this is where we work together to advocate for ourselves for all these changes and advice and all the different things we can do to help each other.
That's really great. And there's so much online now for patients to be able to have these groups and to have that support system. I mean, the physical face-to-face, support groups, some of them do still exist, but the online virtual groups have really been amazing in helping patients find support.
They have. It's been there's a lot to weed through, and some places have better information than others. So as you start, jumping into groups, it's, what works for you or where you find the best information. But these groups help me find some of my best friends, and, we all get each other in a way that nobody else really gets us. So it's really great to jump into these groups and come to webinars like these to learn and listen and get connected with other people that frankly just get you.
That's great. Thank you, Sam. And as a quick review before we move on to our Finding Financial Help section, which I think is one of the most important, I'm just going to, all of make sure you're in network. learn about the various things like copay accumulator and all of the various barriers that your pharmacy benefit manager can put into place to, you know, affect the access you have to your treatments. And also, if you need it, Social Security, disability, and supplemental security income are options if you're not able to work. And you should take every option available to you when your health is, you know, when you need to get better and when you have poor health. So please look into any options that you have available. And finally, you can learn a lot from your community, as we just discussed. As we move on here, finding financial help. So what kind of assistance is available? Well, there's hospital charity programs. One of my friends who was a young breast cancer patient, she was between jobs, 29 years old, and she wound up at one of the greatest cancer centers in the world, which is Dana-Farber in Boston, and she got 100% free care. Now, I'm not advertising that or saying that that's possible for everyone, but the hospitals do have charity programs for special cases, so you should always look into those. Low-income subsidies, copay coupons, which oftentimes come from the manufacturers, patient assistance programs, which can help cover your medication. And finally, we're going to talk about raising your own money, which is using the GoFundMes and the things which we often see now with patients trying to raise money to afford their care. So I'm going to start here with Clara to talk about hospital charity programs. Clara?
Yep. So hospital charity programs are not always available at all hospitals. However, if the hospital is not for profit, they probably do have a program. You can usually find this information by going to their website, and you can usually find their policy that says like who would qualify. So most hospitals have charity care for people with no insurance, but not all hospitals have charity care for people with insurance. So you can see their policy and the application, and then the information that is required to prove your income and your asset information. But you can do it on the website, you can call the phone number on your bill, or you can actually walk in and ask about it. And then I have also found too that some physicians will follow what the hospital decides. And that's true especially for like anesthesiologists, radiologists, pathologists, all those doctors that are kind of invisible behind the scenes, that if you're having something done at a hospital, you're having something done with them too. Low-income subsidies are available to Medicare patients. It's part of Medicare Part D. You apply for it through the Social Security Administration, and it's also called Extra Help. A lot of times you'll get a letter in the mail from Social Security that'll suggest you apply for it, but if you don't get that letter, you can still apply. And then you can apply online through the Social Security Administration, and usually get an answer, I've found, within about 4 weeks, which is pretty amazing.
Wow, I said, wow, that is fairly quick considering it's the federal government.
I know. I usually a lot more time out there, and my patients come back to me and they're like, look what I got. So that makes me happy. Then there's the copay coupons, and we've talked about these a few different times. There's copay coupons and patient assistance programs. So there's copay coupons that are directly from the manufacturer. Sometimes they're just a piece of paper. Sometimes they're an actual credit card that the manufacturer will load an amount on, and then you can swipe at your at the pharmacy or at the hospital or provider that you get your infusions at. You do have to use their brand name drug to get that, and you are not eligible for those if you have any type of government-funded insurance like Medicare, Medicaid, TRICARE, Department of Justice. So for those people, they would be eligible for a disease-specific fund, which is available in that third section through basically manufacturer donations to independent charitable programs, and those are administered by another program. They have specific income requirements. They don't encourage, well, you do sometimes have a formulary list with them, so they might not cover every drug on your regimen, but they do cover, they'll let you know when you're applying if the drug that you're using is covered under their program. And then if those funds are closed, if you don't have insurance, then there's also manufacturer-provided patient assistance programs, and that's where they would send you free medication. A lot of times it comes in advance, so like if it's an oral medication that you're taking, it'll come to be shipped directly to you. If it's an infused product, they'll ship it to the hospital for the hospital to use specifically for you. A lot of times these require a lower income amount, but it's I've found typically between 400 and 500% of the federal poverty level. There's one or two out there as low as 300%, and there's one out there that'll go up to 700% of the federal poverty level. 500% of the federal poverty level for like a family of two is right around $82,000.
Okay, that's a good.
And then, yeah, so who do you ask for help? If you're, there's lots of different things out there, but I think specifically at your provider, there's all sorts of financial advocates. My title, I'm an oncology financial navigator, but I also work with anybody who comes in to the infusion clinic for all sorts of other diseases. They might call them financial counselors, the pharmacists and the pharmacy techs at your pharmacy, and then also nurse navigators and social workers at your provider. So my type of a job is I verify your benefits and insurance. I make sure, our team makes sure that everything is current and ready to go. We try to proactively look to see if a patient might be somebody who might have financial potential for financial toxicity. So I'm looking for red flags. I look to see if you have an out-of-pocket amount that's high, which as far as I'm concerned, anything over $500 to $1,000 is high. And then if you do have an out-of-pocket amount, I sometimes take a peek and look and see, have you been able to pay your bills in the past? And if you haven't, then I know that I should reach out to you and work with you. And I keep track of everything that we get set up and apply for, and I try to help keep track of renewal dates and all that kind of thing, because I realize that you guys, you're out there and you're fighting a disease, and sometimes you get distracted by that disease, and it's very important for you to concentrate on healing. And if I can help share some of that load with you or your caregivers and collaborate, then you can concentrate on healing.
And Clara, so just to confirm, you are part of a service that's available where you work, right? Are you available to the cancer patients at your hospital?
Yes, I am.
Or center, so there's no charge for that. Now, what would you tell a patient who perhaps is maybe at a place that doesn't have a U that's available to them? Is there a...
Well, they might not have a me like with my title, but there's probably a secret me somewhere who has like this passion, who's valiantly trying to do, so a lot of times if there's a nurse navigator or a social worker, they know about a lot of these different programs, or they know if there's somebody that they can connect you with to help you navigate these kind of things.
Okay,
so,
I mean, that's been my experience as well. I just wanted to sort of clarify that for people so that they would maybe know, other code words to ask for if they needed it.
Yeah, I think code work, like nurse navigator, social worker, and those people, if there's not a specific financial navigator, they'll help connect you with, somebody who has the capability to do some of these.
That's great. Now we're going to quickly run through here. I know we're getting down to the wire. We probably are perhaps over it. Let's go through these, websites and things that patients can look at very quickly. And we may or may not get to the caregiver section, but I'll talk about that when we get there. But let's talk about Needy Meds.
Mm-hmm. So Needy Meds is, it's one of my go-tos as a professional in this. I go in there and I look up the medications that my patients are taking, and that's one of the first steps, as I'm looking for the assistance program. It'll tell me the different assistance programs that are available for each medication, and I take it from there.
That's great. So that's it. And it's also a resource that patients can use as well, right?
It sure is. And they have like some prescription assistance cards and just all sorts of different things that patients can use.
That's great. And here I'll talk quickly about the Partnership for Prescription Assistance. This is a free service. Other companies may offer to connect you to these same assistance programs for a fee. There are some out there, but this is free. And most of the times, as Clara will probably reiterate, you can find this sort of information for free if you know where to look. So,
yes, you can.
And on this particular website, there are 2 tracks you can take it's not shown here on the screen, but the first question it'll ask you, will help you find a prescription assistance program for something that you're looking to get support with. And number 2, it can help you find low-cost clinics near you. So this can sort of help you on a 2-pronged approach. And it's definitely, and there's many services out here like this, but like I said, Needy Meds and this Partnership for Prescription Assistance are really great go-tos. And Samantha, I'll let you talk about the SAM Fund. And Sam is one of my favorite people. I'll just add, I know her. So anyway, I'll stop there, but I'll let you talk about it.
I know these are some of the places that you can go for different assistance with, for this having cancer and going. I don't know as much about this particular as I do some others, but they share programs and you can learn about where to go for help. They have toolkits, and it's kind of focused for some of the young adult community and some of the challenges that we face not for myself with a cancer diagnosis, but any sort of illness. They kind of can help you at any point from your diagnosis to the points in recovery, and then to after, to help you navigate through any sort of financial issues you might come up with, and really how to help you through that, and to get disability insurance, how to navigate that system if you can't work during this time that you're trying to recover and get the help that you need for your own health.
Okay, and then we'll talk quickly about crowdfunding, Sam. Which is very common. We've all seen it. We've all probably donated to friends or friends of friends.
Yes, I actually myself have used a GoFundMe account, which was really helpful to try to get myself to a association. They put on a conference that I was trying to get to help get as much information as I could to feel better and meet doctors and other patients and things like that. And using GoFundMe was really helpful to share my information to other people. Other people could share it online, and it was a great way to just share information, and hopefully people, if they couldn't donate, they were still sharing. And there's a couple others listed here on the site that you can use instead of GoFundMe, but some of them do charge fees when you are trying to get the money that was raised. So that is something to be aware of when starting any sort of crowdfunding that way, but they are really great to get your information and your needs out there.
That's great. And I'm just going to this is a quick review. Like I said, all of this is going to be available online, and for you to look over. So I'm not going to sit here and read all of these things to you. One of the things that I want to hit on before we move into empowering your caregiver, which I'm going to go through really quickly, I think we can if we commit to it, is that you didn't hear a lot about Medicare today, and it's because we're going to have to do a whole nother one of these just focused on Medicare, because to cover Medicaid and private insurance and Medicare all in one, well, already we're too long, as you can see. So we will be doing this again, specifically focused on our Medicare population, which and talk about these issues within that space, which are different. Empowering your caregiver. So the first thing, okay, Sam, we're just going to each make a commitment here to just sort of briefly talk about these 5 pages, and so we can let everybody go on about their day. So.
Now, this one is something that's really great to be aware of. I know for myself, my mom has taken off a lot of work to help me when I've needed it. It's a great program. It's something you can talk to your boss about to see if, where they've participated and information that maybe your boss might have on this type of program, and look up information. And that way, you get the leave without losing your job, and it protects all of those, our caregivers who do so much for us, whether it's your spouse or your child, or for me, it's my parent that helps me when I need it. And it just protects all of us and helps us. And there's a lot of information online. And like I said, you can talk to your boss about that as well.
Okay. So Clara, what is a representative payee?
A representative payee is somebody who manages the Social Security benefits on the behalf of a beneficiary. And it's typically when somebody isn't able to do that themselves. If you need to have a representative payee, or you have somebody special that needs one, there's a form. It's called the SSA 11. You would need to complete that, but I did find out that you typically need to complete this process face-to-face. So you should probably just go into the Social Security office.
Oh, good to know. Good to know. Okay. Here we're going to talk about, I'm going to briefly touch on the caregiver's finances and a lot of the things that we can talk about here. It's very similar in the sense as far as the things, caregivers need to budget too. But one of the things that I'm going to give a quick plug to here, which is one of the programs that we have for our members of Patients Rising, which is called LegalZoom Life Plan. And within LegalZoom Life Plan membership, you can get a lot of these things that like will, living will, power of attorney. And one of the greatest things that you can get from this service is that you can actually get 10 to 15 minute calls with, financial planners and lawyers as part of the service. You don't have to pay anybody. It's part of it. And we have, for becoming a member, we have a 3-month free trial of this. So I recommend that to everybody, the LegalZoom Life Plan, which you can find on our website, become a member. So, but anyway, all of these things for caregiver finances, like I said, this will be on the website. Things for caregivers to consider. Again, here's a financial power of attorney, the patient's living will, last will, the caregiver is, all of these things are a lot of this stuff you can actually address with LegalZoom Life Plan if you don't have some of this stuff in place. I know we're down to the wire. So Clara, Sam, is there anything that you want to add to this section before we sort of close out here?
I guess for me, the biggest thing to add would just be, for your caregivers anyway, is, that you're a team, and that when you work together with things like that, that I think that's when you get the most done, when you go into it as a team of caregiver and a patient.
Definitely. Well, thank you for that.
I would definitely agree with that.
Well, thank you. And that concludes, this was extra long. I hope you got some extra information for all of you that joined us today. We really appreciate it. Again, you'll be able to find this webinar at patientsrisingu.org/webinars. And you can join Patients Rising at patientsrising.org. Again, thank you, Sam and Clara, for your time. We're so appreciative, and we look forward to getting this up and out there and engaging with both of you again in the future. So thank you very much.
Thanks for having me.
Yep. Thank you for having me.
Thank you.